In the United States, there are almost 24 million children and adults, or nearly 8% of the population, who have diabetes. Unfortunately, nearly 1/4 are unaware they have the disease. Dr. Naira-Sanoyan of Desert Regional Medical Center in Palm Springs tells us about this disease and if it can be prevented.
There are different types of diabetes, but two major types. It's diabetes type 1, which is insulin-dependent diabetes, and diabetes type 2, which is non-insulin-dependent diabetes. And also, there are diabetes that are associated with another medical conditions.
What are the symptoms for diabetes?
Symptoms of diabetes like excessive thirst, excessive drinking, and excessive urination. Those are main symptoms of diabetes, but also people can present with weight loss, they can present with depression, it can be also possibly just fatigue or generalized symptoms. Treatment of diabetes is different for type 1 and type 2. Type 1 diabetes is insulin dependent, and patients with type 1 diabetes, which is early onset, are treated only with insulin. Drug companies are coming up with different formulations, inhaled insulin possibly, but it's mainly insulin injections. Type 2 diabetes, which is non-insulin dependent, which can become insulin dependent later in life, is treated with oral hypoglycemic agents. That means medications, pills.
What do you recommend to the patient to help them manage their diabetes?
Diet and exercise plays a big role in management of patients with diabetes, and most of the time when patients present with elevated blood glucose level, first thing that we're trying to do as doctors just to try to make some lifestyle changes. Ask them to follow a better diet and physical activities and drinking fluids, things like this. And the next step is going to be basically medications.
What diet or foods are recommended to manage diabetes?
Patients with diabetes, of course, foods with high carbohydrate. Bread is high carb, pasta is high carb, rice, potatoes. Of course, meat. Red meat is not a good source for protein for those patients. Probably chicken or turkey or beans. This is a good source for protein. Many times patients, they don't know how serious it can be to have diabetes and not to take care of themselves. And if patient is compliant and taking medications regularly, following diet and exercising, definitely has a very high success rate of being or having controlled diabetes. Diabetes is not a curable disease, but well-controlled diabetes is a very important process, because basically with controlling of diabetes we can prevent complications or at least delay complications. And people, they don't die from diabetes, they die from complications. We can't prevent type 1 diabetes because it's insulin dependent, and people who develop type 1 diabetes, they have genetic predisposition. But type 2 diabetes, definitely. Type 2 diabetes is basically either insulin resistance or insufficient insulin production in the face of hyperglycemia. And people who develop insulin resistance, they are overweight and obese. So basically weight control and physical activity will help to prevent diabetes.